Fon. You have authored a book, Great Husband, Great Wife. What should have inspired you to do this?
You see, Mr. James, I want to thank you for that question. When I talk to my patients, and especially when I listen to my patients, I had the impression that many of the programs that we had didn't really meet their needs. For example, a man will come into my office and I ask him, "Sir, you were unfaithful to me. You were unfaithful to your wife, and you accepted that you were unfaithful. What could have pushed you?" And he will say, "Doctor, you don't understand me. You will never understand me." I said, "Go ahead and tell me." He said, "Doctor, for 2 years, my wife and I are sleeping in separate bedrooms. You can ask my wife." Then I call the wife and I say, "Is it true that your husband and you are sleeping in separate bedrooms?" And she'll be like, "Yes, that man is an idiot. He doesn't do this, he doesn't do that. Why should I sleep with him?" So I realized that talking to them about faithfulness or HIV prevention will not really help them if I don't talk about their problems, what brought on their conflicts, what can help them. So that's when I started doing conflict resolution. And we started from a simple concept, let's create winning teams. The family is a winning team. The husband is the team captain, the wife is the coach, the children are the star players. They start thinking and acting like a winning team. They resolve their problems, they stop fighting each other. Because when you are members of the same team, you join forces to win the enemy, you don't fight each other. And from there now, they could start resolving their problems, looking in the same direction. And it's been a wonderful experience for me, We've been able to solve many problems, and that is why we came up with this book. It's called the TESHO concept, Team Spirit Holistic Concept. Family is a winning team. And then you could take the same concept to work, because real safety at work starts from home in a healthy relationship with family members. If you leave the home on a quarrelsome note, your day is going to be bad. Every interaction will be bad. So the Team Spirit Holistic Program is a program that cuts across all socioeconomic groups. Everyone understands football. Everyone wants to win. So we help them to go along and be the winning team.
Dr. Fon, you coordinate tuberculosis, and tuberculosis is just as risky as AIDS. How have you managed this program?
Mr. James, when I started coordinating the tuberculosis program, the more I talk to my patients, the more I realized that, many of them cannot avoid tuberculosis because it's an airborne disease, But the highest risk factor is HIV. If you have HIV, you have 9 chances of 10 on 10 of having tuberculosis. But if you're HIV negative, it's only 1 chance on 10. So I told myself, if I really want to help my TB patients, I need to teach them about effective HIV prevention. That is when I went into this program and I started now talking to them, helping them to live faithfully, teaching communication skills to parents and children, teens, so they could talk about abstinence and condom use.
But one funny thing is, in Cameroon, treatment of tuberculosis and AIDS is free, but people still do not go for it. What should be the cause?
The truth is that, Mr. James, when people don't have good communication in their families, it's difficult for a wife to tell their husband, "Please, you've been coughing for 2-3 weeks. Let's go to the hospital," so they can see if it's tuberculosis. So what we try to teach them in our program is let people communicate effectively. And of course, for the nurses and doctors, if they leave home from a bad relationship with family members, there is no way they are going to welcome the patients well in the health centers. And of course, the treatment of the patients will not go to the end. They will be lost in the course of treatment. That is why I try to teach this TESHO program of communication, healthy living in the family, good relationships to the patients and to the nurses, so that in the end we can be able to take our TB patients to the end of their treatment and we can be able to prevent HIV.
To start a program like the one you are doing very well now is always complicated and difficult. What are some of the difficulties you encountered when you started the program? Because it's not easy to discover where the TB patients are.
Yeah, when I took over the program, the cure rate was 60% for TB patients.
Yeah.
Today, the cure rate is 84%.
Wow.
Thank God.
Wow.
But it's been a lot of work. Thank you. It's been a lot of work. And you know the target is to cure 85% of the patients. Yeah. We still have 100% to do. And then, of course, maintenance is not easy. So we still have a lot of work to do, education. And for me, you know, I use the Team Spirit Holistic Program, TESHO program, a lot. I teach people to build team spirit at work and at home. I teach people to communicate well with the patients. Because, Mr. Achayi, if you come to the hospital and the nurse does not receive you well, doesn't communicate well to you, talk to you about your illnesses and so on, it will not help. We teach nurses attitudes and techniques of effective communication. You might think communication is easy, but it's not. It's not easy at all. So there are basics that we teach to the nurses, to the doctors, and to the patient. And that is why we are having these excellent results. I'll say excellent because we are almost getting to the objective. And we need to maintain.
During this training on communication, we have learned that the testing of tuberculosis is free and treatment is free. How long does it take
to treat? Let me correct.
Yes.
The testing, sputum test, is 1,000 francs.
Yes.
For the testing and all the controls.
Which is
it's almost free. Yes. The treatment is free. Yes, we need to know that. So no person in Cameroon today should die of tuberculosis. I mean, all over the world, the treatment is free. So no person should die from tuberculosis. And tuberculosis is a curable disease. The population needs to know that. They need to know that there are 39 centers in the littoral. Almost every health center is a center. So people need to know that. And that is why we brought together the community so that they go back to propagate this information to the population. Why die of a disease when with 1,000 francs you can get cured? They need to know that.
Thanks very much, Doctor.
You're welcome, Mr. James Achayi, and it's been so good talking to you, as always.